And again, the graphic related to vaccination status and hospitalization, as well as that related to vaccination, and that remains very similar to last week. In terms of our positives at hospital, 102, 33 at the Couva Hospital and Multi-Training Facility, 2 in ICU and 3 in the High Dependency Unit. At the Cora Facility, 22, Augustus Long Hospital, 25. There are 11 persons at the Arima General Hospital, 7 at the Scarborough Regional Hospital, Fort King George, and 4 persons at the Scarborough General Hospital at Signal Hill. So if I could have the first slide of the monkeypox presentation, please. Yeah, so as you know, if you could go to the second one, on Saturday, 23rd of July 2022, the Director General of the WHO determined that the current multi-country outbreak of monkeypox is a public health emergency of international concern. Next slide. So just to remind persons what a public health emergency of international concern is, a PHEIC is an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. Next slide. The definition implies a situation that is serious, sudden, unusual, or unexpected, carries implications for public health beyond the affected state's national border, may require international immediate action. And if we could go to the other slide, we'll give an update as to the global situation at present. So as of 27th of July, there's an ongoing WHO update at present. There's greater than 18,000 confirmed monkeypox cases, and the graphic on the right will show the spread of those cases throughout the different parts of the world. Majority still in Europe and US. 5 deaths so far, remaining stagnant since last week, all of which have been detected in Africa. 78 countries have now confirmed cases. Next slide. So I think we skipped a slide. Regionally, countries, for example, Jamaica, the Bahamas, Venezuela, Martinique, and Barbados have all reported cases, and to date, monkeypox virus has not been detected, confirmed in Trinidad and Tobago. Yeah, next slide, please. So these are the regions. All 6 WHO regions have now reported cases. You can see in terms, if you look at the European region, for example, 11,865 of the 16,000 cases are from that region, followed by the region of the Americas, which Trinidad and Tobago is a part, but the majority of the 3,772 from that particular jurisdiction come from the North American region. Next slide. So this is a little background. We had done this before, just going through the transmission. The monkeypox virus is spread from person to person via close contact with infectious agents, lesions, body fluids, can be respiratory droplet if persons have lesions in their mouth. You can get respiratory droplet infections at that point in time. Contaminated materials such as bedding. Next slide. It can cause a mild or severe disease, so the spectrum of disease is quite wide, and you will see in these slides to come what are some of the symptoms. It may cause severe disease in certain populations, for example, young children, pregnant women, and the immunocompromised. This slide gives an example of the actual rash that is seen in various stages of its presentation. You're seeing going from vesicles to pustules and then crusted over in some of these slides, and in different colorations of skin. You see it presents slightly differently in terms of the variations. So just to give an example of what the rash looks like, it looks very much like chickenpox in some instances, and of course resembles smallpox as well. Next slide. So the typical presentation of monkeypox would be divided into 2 phases. There would be a febrile stage followed by a phase of skin eruption or rash. So that first phase normally lasts 1 to 3 days, and it includes fever, headache, swollen lymph nodes, muscle ache, back pain, and low energy. And in the second phase, which is the skin eruption phase, if we go to the next slide, normally lasts 2 to 3 weeks before resolution. So the evolution of the rash normally takes place where you have lesion with a flat base, raised painful lesions then follow, lesions filled with clear fluid, which is called vesicles, lesions filled with pus, which is called pustules, and then scabs and crusts. So very, very similar to chickenpox. On the right hand side, you see all lesions appear at the same stage usually of development, and I say that because there's a variation in this present outbreak, which I'll show next. So people remain infectious until all of the lesions have crusted over, which normally takes about 2 to 3 weeks. Next slide. So, coming out of some research that was done in the existing epidemic, looking at the data so far, and WHO has published some of this. According to the WHO, many cases in this current outbreak have presented differently than expected. So they have atypical clinical features. So we're seeing, as different from before, only a single or a few skin lesions appearing. Skin lesions appearing before fever, headaches, and swollen lymph nodes, which is again unusual, different from the picture that I described before, the clinical picture. Mouth sores, lesions appear in the genital or perianal areas, that's the area of the groin, and areas do not spread further. Lesions appearing at different stages of development, meaning you may have a pustule on your vesicle and a crusted area, which is different from what I described before. The UK has reported a few severe cases of encephalitis, which is inflammation of the brain, and proctitis, which is inflammation of the lining of the rectum. Next slide. So again, going back to the preventative measures, avoid close physical contact with infected or contaminated persons or contaminated materials. Should you display any symptoms previously described, seek medical attention at your earliest or immediate health care. Persons with active mouth ulcers should also wear a mask to avoid respiratory droplet transmission, and generally speaking, infected persons should continue to wear a mask as well throughout the illness, at least for 2 to 3 weeks. The next slide will give an update on the Omicron, and just going back before I close to the update in terms of the VOC distribution in Trinidad and Tobago. This is not monkeypox. So Omicron continues to be the dominant variant in Trinidad and Tobago. Last week we would have said that BA5 was just slightly less than BA2. Now we're seeing BA5 is now the dominant Omicron sublineage, accounting for 59.1% of the samples in last Friday's samples. BA4 now 18.2%. BA2 0.1 was detected in 13.6%, and the rest of them would have been BA2 9.1%. Last slide. So the last slide, as we have COVID-19 still with us, we're asking that you wear your mask when appropriate, watch your distance, and wash your hands. So thank you very much, Mr. Alexander.
Thank you very much, Dr. Parashram, our Chief Medical Officer. I now hand you over to the Honorable Minister of Health to provide today's vaccination figures and an update on other COVID-19 related matters.
Thank you. Thank you very much, Al. Good morning to all. Good morning to Dr. Parashram, ladies and gentlemen of the media, and the listening and viewing public wherever you are. I hope you are well this morning. So there is not much change on the COVID vaccination front. Yesterday, we did a total of 147 doses. That includes boosters and so on. Still very low. 715,336 persons, that is 51.1% of the population, are completely vaccinated. Thank you to those 715,000 persons. 167,163 are boosted. Our appreciation goes out to them, but as we asked last week, we urge people who are eligible for vaccine, for boosting, especially those over 18, to please get boosted. The total number of children in the 5 to 11 cohort, 2,687. So we still continue to urge people to get vaccinated, get that extra layer of protection. At this point in time, I think monkeypox is the topic that most people are aware of and concerned about. So I would like to take off from where the Chief Medical Officer would have stopped. So as the Minister of Health, you would have known that we convened a meeting on May 20th, 2022, which is just about 2 months ago, with CARFA, PAHO, and so on, Ministry of Health, to discuss Trinidad and Tobago's response to monkeypox. Because at that time, we saw it as a threat that we in Trinidad and Tobago needed to prepare for. We did not want to wait until we had our first either suspect or confirmed case to start to prepare. So we started to prepare on May 20th, 2022. That preparation will also have included not only operational items, which I will come to very shortly, but also seeking the intervention of Cabinet to have monkeypox listed as a dangerous infectious disease. That was done. Having done that, that allows us to trigger two pieces of legislation, the Quarantine Act and the also regulations under the public health regulations. Whilst we were doing all that, we started to build local capacity for testing, training, epidemiological surveillance, raising awareness, and so on. On July 23rd, I believe, WHO then declared it a public health emergency of international concern. And I think we can be grateful that we were proactive from May 20th. The WHO then made recommendations that countries should look at, and based on their recommendations, countries can slot themselves into different groups. We are in Group 1. What are the characteristics of Group 1 that defines whether you're in Group 1, Group 2, 3, or 4? Group 1, states parties with no history of monkeypox. So that's us. We don't have a history of monkeypox in the human population, or not having detected a case of monkeypox for over 21 days. So we have never had a case, so that also applies to us. Therefore, that places Trinidad and Tobago in Group 1. Group 1 states, therefore, have 9 action items from 1A to 1I to implement. I think very wisely, all 9 action items that WHO has identified for Group 1 countries, we have already implemented by and large, some completely, or most completely. Establish health and multisectoral mechanisms, no stigmatization and discrimination, which I spoke about 3 weeks ago. Establish and intensify epidemiological disease surveillance, which we have, and which was strengthened for COVID, which will now carry over for monkeypox. Detection capacity, which is 1D. So we have our testing capacity both at CARFA and at Trinidad Public Health Lab. And I think every member of the media would have this. So we are as in a goodest place as any, based on WHO's Group 1 recommendations. Then you move on to Group 2. We are not in Group 2 as yet, and I'll just tell the national population what Group 2. Group 2, states or parties with recently imported cases of monkeypox in the human population and or otherwise experiencing human-to-human transmission of monkeypox virus, including in key population groups and communities at high risk of exposure. So that is how WHO is stratifying countries based on their exposure to the virus, detection of the virus, and so on. So right now we are in Group 1. We have no history of monkeypox in the human population, and because of that we have not had a case for over 21 days. So we are firmly in Group 1, and we have implemented, even before this came out on Saturday, July 23rd, all 9 of these recommendations. So Al, I thank you for the opportunity, and I think now we are open for questions.
Yes, Minister. Next up is the question and answer segment. Members of the media, you are familiar with the format. Media representatives, you are asked to state your name and the name of the media house that you represent before asking no more than 2 brief questions in the first instance. Please ask your questions to the relevant members of the panel. And of course, we will take 1 question per media house. And we will start this morning with Mr. Bihari azpnews.com.
Good morning, Fire Harry, azpnews.com. My questions are for the Minister. Minister, good morning. What happens now with the parallel healthcare system? And if we get in case of monkeypox, would you have COVID patients and monkeypox patients in the same facilities? And my second question, in terms of funding, do we have the sufficient funding to deal with any outbreak of monkeypox? Thank you.
Thanks, Bryce. I'll answer your two questions. So coming out of the cabinet note, which I took, which was approved, I believe, 2 or 3 weeks ago, Cora has been designated as the facility to treat with monkeypox. And I think you asked a very good question. There will be no mixing of COVID patients and monkeypox patients in any facility. As far as the parallel healthcare system is concerned, as you know, we have started to decommission the major hospitals. That has been done with Point Fortin, Arima. We also gave instructions, I believe, last week or week before, to stop admitting new COVID patients into St. James. That has been done. And the last count as of Monday, I believe, St. James had 1 patient. So St. James is going to be free of COVID patients very soon, and that will be returned for the general use of the Northwest Regional Health Authority and take some pressure off of Port of Spain General Hospital. So we continue with the decommissioning of the parallel healthcare system. And as far as funding is concerned, yes, the funding is there in case we get a monkeypox case. But bear in mind, the monkeypox virus is a self-limiting disease, but that should not lure us into any sense of complacency. So we urge the population to heed the warnings about that the Chief Medical Officer just gave, and which I have been given. You try to avoid skin-to-skin contact with persons, especially who have recently come back from one of those, is this 75 countries still? Yeah. 75 countries that have been identified as having monkeypox cases. Thank you very much, Brian.
And thank you, Minister, for your response. We move to the Newsday next. We're ready for your questions. Good morning. Paula? Okay. All right. So
are you hearing me?
Mm-hmm. Yes, we are. Please go ahead.
Right. Sure. So my two questions are, on Monday, the CAFA Executive Director, Dr. Joy St. John, would have said that there are people who know that they are infected but are still traveling throughout the Caribbean because they are coming to various festivals and events. Is there any way, or are there any plans to implement screening measures at our ports of entry? And the second one is with regard to the point that the minister just made about making sure you avoid skin-to-skin contact, especially with people who may just have come back from these countries. In light of our increased openness and the number of open-air parties and events, are there any other tips that you can give to people? Thank you.
Thank you, Paula. So the port of entry screening for fever has never been suspended. We started that with COVID, if I remember correctly, in February of 2020, and it continues, but that is for fever. There is no screen for monkeypox at ports of entry. It's a screen at the airports and ports of entry, so that continues. And your question about open air, the monkeypox transmission, as the CMO has said and I have said, is mainly close skin-to-skin contact. So any activity or endeavor that encourages close skin-to-skin contact without clothes is where the monkeypox virus could be transmitted. As we lifted the mask mandate on July 16th, I believe. And I took a deliberate drive along Independence Square this morning, and I walked along Park Street yesterday visiting TNTech, First Citizens Bank, Rand Credit Union, Republic Bank. I am so pleased to see the number of Trinidadians, and I am hoping the same thing is happening in Tobago. The vast majority are still wearing masks. And I think I really need to congratulate once again, I did it last week, but I can't congratulate the average person for being so wise and so accommodating and working with us and heeding the advice to continue wearing masks. We urge people to continue wearing masks in certain settings, and you're going to see some ads coming out tomorrow in the newspaper. We are asking people to continue wearing masks in public transport, places of worship, whilst you are out shopping, especially in that retail sector, and in any mass gathering. Do your risk analysis, and again, I want to congratulate and thank Trinidad and Tobago for the majority of people I have seen, very anecdotal and unscientific research that I have seen, and other people give me the same reports, that the majority of people continue to wear masks, and I am so appreciative. We have put our faith in Trinidad and Tobago to help manage this phase of the pandemic, and our faith has not been misplaced. Thank you very much, Paula.
And with that, we go across to Guardian Media Limited. We are ready for your questions. Good morning.
Good morning, Kevin Falvin, Guardian Media. I hope everyone is well. Minister, with vaccinations moving so slowly, are you worried about more stock expiring, and what would be the ministry's move if that happens? And for the CMO, God forbid that we get monkeypox, what is the quarantine and treatment protocol for monkeypox? I mean, can people quarantine at home, and what medication do people or the hospitals use to treat patients with monkeypox?
Okay, thanks. Two excellent questions. So I'll give you the expiry dates of our we have three brands of vaccines in the country for COVID-19. The Pfizer Pediatric, which expires, is it October 2022? October 2022. At the current rate of uptake, of course, we're going to have excess. And then we have Sinopharm and Johnson & Johnson expiring around March 2023. And given the current rate of uptake, yes, there will be some at the current rate of uptake that will not be used. So that's the expiry dates for the current stock of vaccines. CMO?
Yes. So the recommended quarantine period for the virus, and this is based on the characteristics that are known so far, 5 to 21 days in terms of the incubation period. Therefore, the quarantine period will be approximately 21 days. If you are a very close contact of a known case, generally speaking, in most instances, because it's a different virus, it requires close contact. In the first instance, we're looking towards possibly self-isolation at home, which is used across the world for this particular virus. Only if we have persons coming straight into the country, for example, picked up at a port of entry, in those cases, we may look at isolation within one of the facilities to prevent spread, bringing that disease into the population or even into the households. So if it is already a person presenting to one of the facilities from within Trinidad, exhibiting the symptoms, the quarantine will most likely be in terms of home isolation. Of course, there's discretion at the level of the CMOH based on the particular instance, but we will try our best to do home isolation for those particular cases. In terms of the treatment, generally speaking, it is symptomatic relief. So we use medication to control the fevers, for example, making sure persons are well hydrated. If you go to the stage of encephalitis, of course, supportive care in hospital is required, for which we have the capacity at CUVA and at CORA, which is the designated facility at this point in time. So supportive at this point in time. We are in the process of continuing bilateral talks with regards to the antiviral. which is available, becoming available for that particular virus as well, to bolster the treatment regime.
Let me just go back to the designation of CORA. I also was in contact with the Secretary of Health for the Tobago RHA last week, I believe, and I asked her to designate a similar facility that they deem suitable for a case of monkeypox in case Tobago should get one. So we'll have one facility in Tobago, one facility in Trinidad. Okay, thank you.
Thank you very much, Minister. And CMO, we go now to the Express for your two questions. Good morning.
Hi, good morning, everyone. On the panel, Kamery Fletcher from Express. So my question will be for the CMO. CMO, you've mentioned that BA5 is now the dominant sublineage. And we see how quickly that became, because just recently you would have stated, we would have reported our first case, right? And taking into consideration the characteristics of BA5, it being more transmissible, not necessarily more dangerous, because we haven't seen too many hospital cases, which is a good thing, and very few deaths. But my question is, how accurate are the daily positive cases that's put out on the dashboard by the ministry? And my reason for asking this is because we would have seen, let's take in the last 5 days into consideration with the cases, you would have had a total of 654 cases, and that would have been out of 1,963 persons being tested. However, all of these persons were tested at public facilities and not private facilities. So we also know that a lot of persons are opting to take home kits. So my question is, how accurate are the daily positive cases? And is it that doctors at private facilities, are they obligated to report to the ministry when persons test positive? And persons that decide to take these home kits, are they also obligated? Or do you think a lot of persons now are taking home kits and it's not being accounted for in the daily cases?
Okay, so that's a question, that's a policy question. So from day one, PCR testing in both the private and public facilities are reportable under the public health regulations. So those positive tests that you see are for both private and public using PCR. On the issue of antigen testing is not reportable. So let's make that distinction, right? Yeah. So the self-test is not reportable, but the PCR tests at both public and private are reportable. Okay, Marie? Thank you.
Okay, thank you very much. And with that, we go back for a follow-up question. We accommodate azpnews.com.
Thank you very much again, Major. CMO, I had asked about the quarantine period for COVID-19. So can you just give us the idea of what it is now? And if someone takes who tested positive and then he tests negative within a day or two, should he can he go to quarantine or must he wait the 7 or 10 days? I don't know how much it is now. Thank you.
So there's two different things, right? There's quarantine period for COVID-19, which is 10 days at this point in time. So that means if you are deemed a contact, right? A known contact, then that 10-day period is the period that we have in place. In terms of isolation, which means that you have been infected, for asymptomatic persons having absolutely no symptoms, we look at 10 days. Those who have displaying symptoms, we wait the 10 days, but usually 3 of the last days need to be without symptoms to be released. There's no test that is required to say that you're negative or positive prior to release. However, you asked about the testing. So again, the CMOH has discretion in terms of releasing persons earlier from quarantine. If you do have a negative test and it is validated by one of the labs that are being utilized, then the CMOH has the discretion to allow persons out of isolation earlier based on the result of the test. So they can release you earlier if you have a negative test.
Thank you very much, CMO. We go back to Guardian Media Limited for your follow-up question.
Once again, As the monkeypox situation evolves, is the ministry considering travel restrictions or travel passes and the implication of monkeypox, as we've seen in other islands? I mean, like, would someone need to get tested and prove that they've been tested before entering?
At this point in time, there is no consideration at the Ministry of Health to recommend any travel restrictions at this time.
Thank you very much, Minister. And we go back to azpnews.com for a follow-up question.
Thank you. Are we seeing more reinfections with the BA2 and the BA5 now? You know, more people are, have been reinfected once, 2 or 3 times now.
I think prior we would have answered that question last week with Kevin. I think Philomene had asked the same question last week. It's extremely difficult, especially with antigen tests being done, to determine the percentage of reinfections that are occurring. But at least from a theoretical perspective, we expect that more people would be reinfected with this particular variant, because that's one of the hallmarks of the virus itself.
We have no more follow-up questions. You want to?
We expect that there will be a higher number of reinfections.
Thank you very much, CMO. And there being no more questions, we have come to the end of today's media conference. And as we close, we want to emphasize that even though we have begun to roll back restrictions, the COVID-19 virus is still among us. Please be vigilant, be responsible, and continue to protect yourself and your loved ones. We remind the public that COVID-19 vaccines are safe, they are effective, free, and available at all our health centers, all 109 health centers across Trinidad and Tobago. And if you or your relative, 5 to 11 years of age, haven't received the COVID-19 vaccines as yet, we encourage you to ensure that you all get vaccinated. We also invite you to visit the Ministry of Health's website at www.health.gov.tt and social media pages for accurate and up-to-date health information. Please be safe, and goodbye for now.
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole world struggling to contain a pandemic and unprecedented amounts of scientific work taking place, the road to finding the COVID-19 vaccine looks more like this. But first, let's take a look at the usual path. During preclinical trials, the vaccine is tested on animals to determine whether they develop antibodies to the disease-causing germ. If these trials are successful, the candidate vaccine moves on to phase 1 trials in humans, during which the vaccine is given to a small number of healthy adults to assess its safety in humans. The results of every phase are reviewed by independent clinical experts who assess the research team's findings. Sometimes they'll pause the trials to check the results, always making sure the candidate vaccine is safe. The next phase involves testing a larger group of people to find out the appropriate dose, whether it stimulates an immune response, and of course, to assess its safety.